Hello, everyone. Welcome back to my podcast, Sophie Talks. In today's episode, I'm going to talk about 5 different topics which felt important to highlight and help future nurses understand the society of nursing. The flow of this second episode will start with me talking about each topic and adding in some key learnings that help to deepen my understanding about each of them. Each topic was chosen with careful consideration and includes some of my experiences as well. Be sure to listen to this while reading and looking at the artifacts I attach to each topic on my website. For the first topic, I chose to focus on highlighting the racism that is still prevalent in our healthcare system. This was explored during one of our lectures, and it is something my friend and I have experienced during our time in our rotations this semester. As someone who comes from a minority group in Canadian society, the effects of racism are still felt even if they are not said out aloud. Going into the rotations for our summer semester, I was excited and open to working with everyone. However, there were instances when some staff in both units would outwardly favor those who shared their background. They would be more proactive and teach them how to perform certain assessments instead of teaching all of us. There was another time when one staff member saw us, gave an unfriendly look, and refused to teach us. Sounds too good to be true. I know, but unfortunately, it did happen. Research conducted by Otsakovic et al. 2023 found that racism in the workplace directly affects patient care and forms unconscious biases. It also alters workplace well being and is considered a taboo topic to bring up, all for the sole reason of not being labeled as racist. Another study done by Hamid et al. 2022 found that patients from a racialized minority receive inadequate care, and this can lead to the distrust of the healthcare system in general. As students, we were taught that we are guests in the unit and that we are not to get in the way of the staff. We were also told that we should not complain if we see negative habits and just remember that we don't follow them. Personally, this concept seems unfair, because why are we supposed to be accepting of the harm either done to us or even towards our patients? I can understand the perspective of our instructors and our school, but that does not make it right. For the second topic, I wanted to highlight the insights I gained from rotating on the mental health unit. The reason people come to this unit exists on a spectrum. It can range from a mild condition, where taking a moment away from society can help them re regulate themselves, to severe conditions where they may need to be under intensive pharmacotherapy to manage their symptoms. I was able to witness different kinds of patients within that spectrum. I witnessed many patients self stigmatizing their conditions, as well as a stigma originating from their families or support system. As someone from a psychology background, it was disheartening to experience to see them put themselves down and to not have a good support network. As mentioned in a study by Wright et al. 2025, not everything must be managed by medication. Creating sensory rooms and/or buckets, providing workshops, targeted group therapy, and tips on how to strengthen their support network can lead to a wider range of benefits without the side effects from pharmacotherapy. Despite that, there were positive moments I saw between patients in the unit that reflect the research findings of Cooper et al. 2023, where it was mentioned that patients within the unit tend to have a sense of solidarity with each other. This also helps to fulfill the need to connect with others, which can serve as a time to communicate, especially when the nurses are busy, and to help provide a positive experience while in the unit. The combination of research and my artifacts reminds me that we are at our own pace in life, and just because others are in a better position than we are does not mean that we will not get there. Life is like a roller coaster. There are times when we will be at the top and highlight of our lives, but there will come a time when we must come down. And that is not a bad thing. It is simply how life works. For my third topic, I focused on the interactions I had in providing care to pediatric patients in the maternity child unit. For the longest time, I've had a great passion for working with kids and adolescents. Before transitioning into nursing, I worked in various jobs that focused on educating and caring for all kinds of children in different capacities. Some required patience and extra care, while others were more expressive and involved guiding them through a specific topic. When becoming part of the care team for a pediatric patient, it is not just them, but also their families that we must take into consideration when planning out the next steps of their care plan. Lately, there have been more instances where illnesses more commonly seen in adults are appearing in the younger generations. Current research is lacking, and healthcare systems are not as equipped to handle cases that have not been commonly seen in children. According to Fields et al. 2024, our research and healthcare system must adapt to expand certain health crises to those from a younger generation as well. To add to providing care to pediatric patients, when I was in the unit, building rapport with the patient and their families was a foundational concept I worked to strengthen when checking up on their conditions. Despite those 2026 research targeting how hospitalists should communicate with their pediatric patients, it is equally relevant for nurses. Those research talked about how to build trust. We must communicate more effectively between physicians, nurses, and patients, and vice versa. There are times when we must also apply our nursing knowledge to advocate for better care for our patients. When I was caring for my patients, there was a time when they were very thankful, despite being just a student, and appreciated the care I provided to help them feel better. As nurses, it is our job to help our patients leave us in the best circumstance possible. What I noticed people forget to remember are that children are shaped by their experiences and the environment that they are in. Personally, I believe that there is no such thing as a bad child, but rather a misguided and maltreated child. It is our job as adults and professionals to guide them down the right path. For the fourth topic, I chose to explore the impacts of self care and why it is important to incorporate it into our daily routine, especially as nurses. As a student in a compressed nursing program, there are some classes and/or semesters where the load is heavy and causes us to weigh our options between, hmm, should we really be submitting this now? Or should we go to sleep or even eat on time? It is a common theme where my classmates and I are all experiencing. But there are many occasions where we wish we could have started an assignment earlier or even paced ourselves so that we do not cram things at the last minute. I think it is fair to say that if we were all to participate in a study on the effects of burnout on students, specifically those in healthcare fields, I would say that there is a positive correlation between the two. In fact, it is so relevant that the research done by Blevins 2024 found that the demand does not equal the supply for nurses in our healthcare system. This allows for a higher incidence of burnout, which in turn creates a ripple effect on the remaining nurses and increases their load and likelihood of health issues. That calls to mind some of my classes in the previous semesters, and our current class, Nurse 2021, have highlighted the importance of self care in our daily routine. I think one of the many reasons why many of us do not incorporate it is similar to the reasons stated in research by Damayanti et al. 2026, where they found that students feel the need to either ask permission or to be validated in taking a break from their assignments and/or studies. Additionally, because of the limited time students face, they tend to look for more portable and time-efficient ways in their self-care. Self-care as a whole needs to transition from just being talked about to being incorporated in the nursing culture right at the beginning, instead of being perceived as nurses must always be on the go. For the fifth and final topic, I chose the importance of reproductive coercion and the nurse's advocacy role. This is a topic not generally talked about in mainstream media, but it is a common and silent reality that certain pregnant people face. A reflection assignment from our class, Nurse 2021, wanted us to explore more on this topic and illustrate how a patient's autonomy can be overridden by a partner, culture, system, or even a care provider. Through my research, I found two articles highlighting the effects of reproductive coercion. The article by Wellington et al. 2025 found that women often feel trapped by their circumstances and often face threats and coercion regarding their pregnancy and bodies. Some women even felt guilty, self blamed, and were often stigmatized when they wanted to talk about the topic. So, they felt that they couldn't reach out for help. Consequently, this severely damages their self concept. The second article by the International Association of Forensic Nurses, 2022, noted that most cases of sexual violence, assault, rape, are committed by and then reported against their acquaintances or someone that they are familiar with. This can lead to many women in this situation to look towards unsafe abortions and inflict long-standing trauma. While I have not been pregnant, I can relate to the situation these women are in. These circumstances made us feel as if there's no way out, and that this all started because of something we did, when in reality, it was never our fault. It was the person who did this to us. As future nurses, we will encounter patients who have gone through these circumstances, and it is our job to advocate for personalized, trauma informed care for them. It is important that for anyone who has experienced these circumstances, we must remember that no matter what we have experienced, we are still us, and they cannot take that away. The main relational inquiries I felt that connected well to my topics are the concepts of knowing versus not knowing and applying social determinants of health. For all these topics, in each of them, I have mentioned my experiences and an interpretation, but for another person, this may be completely different. Like the concept of knowing versus not knowing states, we really do not know what a person has gone through and experienced. It is best to keep in mind that we should treat everyone with the same respect we would like to receive, and if something bothering them arises, that is the only time, if the other person permits, to ask what troubles them. For the concept on social determinants of health, specifically in the topics on racism and reproductive coercion, this concept allows us to consider structural factors and critically think on what is the best outcome for our patients. A lingering question I would like to propose to you, my dear audience, is that do you think we will ever encounter such a time where our system and workers actually change for the better, and it is not just through fancy vocabulary? Now, you must be tired from hearing me talk too much, but I just wanted to end this podcast to highlight the amount of growth I have gone through, and that it is 100% possible for you to experience as well. We both have much more to learn as we wade through this path that we call nursing. I am excited to learn more and hone into my skills to become the best RN I can be. Until next time, future nurses, talk to you again on the next episode.